Thank you, everyone. I want to start by saying our thoughts and prayers with the people of Nova Scotia, Canada, after a devastating act of violence yesterday. Nova Scotia, those that don't remember this, Nova Scotia gives us our Christmas tree every year on Boston Common. Premier Stephen McNeil brings a large delegation to Boston Common for our celebration, lighting our tree. They're the kindest people you'll ever meet. I can only imagine their grief and shock they're experiencing right now. So I want Nova Scotia to let them know that from Boston, we're standing with you as friends. Yesterday's numbers updated as of yesterday. We do not get today's numbers yet. Massachusetts had 38,077 cases of coronavirus. That's up 1,705 from the day before. We have 1,706 deaths in the Commonwealth of Massachusetts. That's up 146 from the day before. In Boston, we have 5,516 cases, up 116 from the day before, and we had 17 deaths as of yesterday. Additionally, that's 175 in total. As I've been saying all along, our thoughts and prayers go out to those who have lost loved ones and also those families that are experiencing a lot of suffering during this time. I want to remind everyone what we should be doing to protect yourself and to help slow the spread of the virus. Stay at home as much as possible. Only go out for essential items. Wash your hands with soap and warm water throughout the day. Cover your face when you're outside. Give people a 6-foot buffer, a distance between you and the people around you. Avoid crowds of any kinds and social gatherings. Yesterday, we had 7 sound trucks broadcasting this information in 7 different languages throughout the city of Boston. We got positive feedback from communities that made a difference, but we still know not everyone is getting the message. Yesterday, we had issues at the Divine Golf Course in Franklin Park and the George Wright Golf Course in High Park. Groups of people were playing golf, even though the courses are closed. In one case, the Boston Police Department had to come and tell them to leave. This shouldn't have happened. This shouldn't need to be, you should not need to be told. But we won't hesitate to send police officers to deliver the message, if necessary, deliver citations. We also had people yesterday playing soccer. We had people doing walking, but socializing while you're walking. We had people, a lot of people out there because of the good weather. We need to stop the spread of the virus, and by doing this is not by gathering in social gatherings or socializing. It's by staying at home, self-isolation, physical distancing. In better news, we're hearing that the BAA, that there is very little activity on the marathon route today. I want to thank all the people who are listening and doing the right thing. Obviously today, right about now, we should all be either watching on television or at the finish line, watching the runners come in and celebrating Patriots Day. We cannot do that this year the same way, but we are asking people to still celebrate Patriots Day by social isolating, social distancing, physical distancing, but by reaching out to people, letting them know that you're there for them if they need you. Updates on the Boston Hope Medical Center at the BCEC. As of last night, we had 162 total patients being treated there, including 86 on the hospital side and 76 on the respite side for homeless individuals. In all, the Boston Hope has served over 250 patients. I want to thank all the folks that helped make this happen as well, because clearly it's helping us with our hospital capacity and allowing our hospitals to treat the very sick. This facility that we stood up in 5 days is able to treat a total of 1,000 people. The City of Boston has operated 500 of these beds in partnership with the Boston Healthcare for the Homeless. This level of care is possible because we made our most vulnerable residents a priority from the very beginning of this crisis. We started in March by building quarantine and treatment facilities next to our largest shelters. Then we got 172 beds in the Suffolk University dorms, improving shelter spacing. We got 70 more beds at the former hospital on Comm Ave in Brighton. We added 250 beds at the Newton Pavilion in partnership with the state. We have 50 beds for veterans at a facility in Brighton. And Boston University provided more than 75 rooms for Pine Street and staff. Because of all this work that's been collectively put in together and the supports of these partnerships, we have the capacity to shelter and treat every single homeless individual safely and be able to keep people out of the hospital system. We're going to continue to make sure this is the case. I want to thank everyone involved in that ongoing effort today. On personal protective equipment, we are continually working to source and supply PPE to our first responder in the wider medical community. Today, we are starting a program of decontaminating the N95 masks used for our first responders. I want to thank all the people part of that, Partners Healthcare, and Battelle has agreed to help us in their facility in Somerville. It's going to take some pressure off sourcing for PPE and police, fire, and EMS. It's also going to ease the pressure in the larger system of the supply chain that medical systems are drawing on. So what it means is we're going to be able to take the current N95 masks and be able to clean them so they can be reused. I've heard they can be reused up to 20 times each if we have the proper decontamination. Testing for COVID-19 is an issue across the country, as we keep hearing on the news and reading in the papers. I have an update here in Boston. We've been working with hospitals and community health centers to create and expand testing sites across our city. You can always start by connecting with your healthcare provider or calling 311. But many of these sites you can contact directly to schedule an appointment. So to make it easier to find a way, to be able to contact and get a test site near you, we've created a mobile testing app. It's available on bphc.org. That's bphc.org. That's a testing access map. It includes locations, hours, phone numbers, and websites for testing centers. They'll be updated as our new sites come online. The goal is to have every community health center able to provide testing to the residents in their neighborhoods. We are also breaking new ground in transparency about testing access. Starting today, we'll be sharing data on testing at by neighborhoods and zip code levels. So far, we've been providing total confirmed cases and cases per capita for your neighborhoods. Now we can include the number of people tested and the rates of positive tests for each community. We are looking at this kind of information and data every day to inform our strategy for deploying resources, conducting outreach, and providing communications to the community. And we're constantly looking for new ways to improve and expand that work. Starting today, we have also expanded our text message alert system from 6 languages to 11 languages. If you have already signed up, you will continue to get the messages. If you have not signed up yet, we have a new number. Text the word BOSS COVID, BOSCOVID, to 888-777. That's text the word BOSS COVID 888-777. I think we have something here somewhere. We're supposed to have a flyer here, but we'll get it out to you. You can find the codes for the 10 other languages if you wish to get information in your language at boston.gov/coronavirus. Getting all of the right information right now is critical for everyone in this crisis, and you should only rely on trusted sources. And protect yourself from predators who will take advantage of this situation. We continue to get reports of scams targeting seniors and other folks in the city of Boston with false offers of federal relief designed to get personal information from you. Recently, we've been alerted to scams targeting small businesses with claims about SBA loans and grants. So we're urging everyone to protect themselves, and we are providing information and resources to help you with that. We're sending out warnings to our small businesses. We have a guidebook with up-to-date information about the new federal programs. You can visit the City of Boston's website at boston.gov/smallbusiness or call 311. If you think you may be the target or a victim of a scam, we're asking you to call 911. This week is school vacation week, and I know it doesn't feel like school vacation week for a lot of people or like any other April we've experienced, but I want to make clear that our support for Boston school children does not take a break. All of our 65 meal sites remain open every day this week. After Friday's distribution, we were up to a total of 438,000 meals served. And starting today, City Resources, we have opened 6 new meal sites that will serve all residents in the neighborhoods of East Boston, Dorchester, Southie, Roxbury, Mattapian, and Brighton. For hours and locations, we're asking you to call 311, or you can visit the online map at boston.gov/COVID-19 food map. It shows all the food services and resources for all our residents, including youth meal sites, food pantries, and so much more. We are working every day to meet the needs of Boston's residents. Our young people, our seniors, our homeless, our vulnerable residents, our essential workers and first responders, and everyone in our city. I believe every single person has value, and every single person has a role to play in getting us through this. I want to close by reflecting on this weekend that just passed in the city of Boston. Saturday was the service for Officer Jose Fontanez. We stood along with many police officers and members of the public safety community to pay our respects while maintaining physical distancing. It was certainly a very emotional time and day in our city. Officer Fontanez served our community faithfully for 29 years and protected people. He represented the best of us. But at the same time, we saw terrible acts of violence in our city. On Wednesday, a 17-year-old young woman was murdered in Dorchester. On Saturday, a 16-year-old was shot in Jamaica Plain. And on Saturday night, a 10-year-old girl was injured by gunfire in Roxbury. The first thing I want to say is that my heart goes out to the families and the communities. We are doing everything we can to be there for you and to make sure that this is not a trend. The next thing I want to say is to anyone who fires a gun right now is you're a coward. You put everyone around you in danger. You bring trauma and suffering on your community, and you will face justice. But everyone else who was there on Saturday night has to look at themselves as well. The situation came out of a crowd that was gathered in an apartment, ignoring a curfew, ignoring guidelines, ignoring their community. This infuriated me, other elected officials, and certainly the community. People are telling me how angry and upset they are. I want the youth and young adults who were gathered that night to look what happened. Ask themselves, is this what you want to be a part of? Look at the little girl. Look at your own siblings, nieces and nephews. Look at your grandmother and ask if she deserves to be safe. We're doing everything we can to protect every community from a pandemic that is taking people's lives. We're doing everything we can to support people in need of resources. The last thing our community needs right now is violence. I understand the situations are difficult. Positive outlets are limited. Our Office of Public Safety is working on intervention plans with our trauma teams, our street workers, clergy, community leaders, and the Boston Police Department, and other partners. We have paused a lot of things in our city. We did not pause our violence prevention or our public safety efforts for 1 second. You're going to hear more about these strategies moving forward, but right now I want to say we need to be a united community. We need to continue to working together. We need to stay focused on keeping every single community safe from harm, and we need every single person to do your part. I want to thank you. I have a couple questions that I'm going to read, and then I'll open up for questions to the reporters that are here. The first question is from Danny McDonald at the Boston Globe. On CNN last night, the mayor said he was disappointed with people who golfed, played soccer, and congregated in public yesterday. Is the mayor considering instituting a social distancing fines like in New York City, where the penalties were recently increased up to $1,000? This is not something that I want to do. I don't want to put fines on our residents who are already being financially burdened. But as we did this weekend, we sent Boston police officers to disperse crowds at Franklin Park. We will continue to target areas where people are gathering. I know that we've been dealing with this for several weeks now, and people want to take advantage of the nice weather. And that's something that they can do by take a walk in your neighborhood. It's important that we have to do this. Wear a face covering when you go outside. This weekend I was disappointed in people. Social distancing is what gets us through this, and we saw a lot of people not doing it this weekend. I saw a lot of people not wearing face masks. But I did see a lot of people doing it as well. So I want to thank the people that followed what we're suggesting here to stop the spread of the virus. We need to think more about people in the community around you, staying physically distant, wearing a mask, covering areas is a small sacrifice when it comes to keeping fellow Bostonians alive. I have a question from Dan Housley at Channel 7. The per capita COVID deaths in Boston are significantly lower than statewide. Do you have any idea why? And I'm going to ask, and then the answer to this question might help drive strategies in the city and statewide going forward. I'm going to ask Chief Marty Martinez to address this question. It's right there.
Yeah, so to the answer to this question, I mean, I won't speculate as to why there is why we have a lower rate than what we're seeing across the state. But what I will say is we're looking every day at the data, and it tells us that our most vulnerable residents are more likely to succumb to the illness, whether it's those folks over 70 and 80 years of age who are dying, as well as those with underlying health conditions. So we have about 3% of the cases of folks who've gotten the coronavirus in Boston have died, and so we're definitely looking at what that says about the severity of the cases, why we learn more from our hospitals. But again, I think we're looking, just like the state is, at that data to try to better understand why we see the cases we see and the death rate we see.
Any other questions?
Mayor, is it time for that stay-at-home mandate or a mask order if you yourself have been disappointed with what you're seeing?
The question is it time for a mandate for a stay-at-home order or a mandate for wearing masks? I think that we're not there yet. Certainly, it's something we're exploring the opportunity about the masks here in the city. This week's going to be rainy, so we won't have a problem. Next Saturday, I think the forecast is for sunny and sunny, 60 and sunny, excuse me. Again, I think the responsibility falls on each individual. I think at this point, I don't know how much more serious we can be. In Massachusetts, we're the third highest rate of COVID positive folks in the country. New York's number 1, New Jersey's number 2, Massachusetts number 3. The way we fall out of the number 3 spot and start going down the list is by not having contact with people. And I think that I would hope. I think the majority of people understand that today, but I think yesterday I was watching a young person being interviewed by one of the TV stations golfing. He was smiling. Nothing to smile about. Nothing to be proud about. Not impressive on the golf course. It's closed, and asking people, that was a completely irresponsible move, and he was irresponsible to his family and to anyone around him. And I'd say the same thing to everyone else. I mean, I'm not here to be. I don't want to be. Certainly as the mayor, you don't want to be telling people off, and you don't want to be pointing out people's shortcomings. But in this particular case, people need to get the point here. I think that I know it's for myself and other mayors. I was on a call last night with other mayors from Massachusetts, and we had the same conversation, just scratching our head about people being out, not understanding. We're not going through this and going through this exercise of shutting down society because it's a game. We're doing it because we want to keep people alive. So I'm hopeful that people will get the message, so we don't have to take those extra precautions.
Mayor, the governor said we're in the middle of the surge. Do you think in Boston we're at the worst, or do you think the worst is yet to come? I know it's all speculation. If we are in a surge, do you have any modified advice to people getting their grocery shopping and stuff? Just anything that we can tweak like New York made?
There's a couple of questions here. One is, as far as the governor commented that we're in the midst of the surge, do we think the worst is yet to come? And then the second part of that is roughly, can we tweak some of precautions around groceries? So I'll come to that one in a second. I think that the worst is yet to come for a lot of people. I think even when we'll be on the surge, we're still going to have positive cases of coronavirus. We're still going to have loss of life. And I think that, in theory, we might be on the other side of the curve, but for families, that devastation of losing a loved one is going to continue to happen for the foreseeable future. And that's why I think it's extremely important for us to continue to take precautions. We're seeing numbers. Yesterday, we had positive cases of 115. It was probably the lowest in the last 7 days as far as increases, but that doesn't mean anything because today could be 200-300 cases. And so you can't really read into the data yet to see where we are in the curve, but I definitely think that we still have a good amount of days in front of us that we have to take really precautionary actions. I think when it comes to shopping and grocery shopping and other things, I think that if people are shopping, you need to have a mask on, you need to have gloves on. If you go to a corner store, if you go to a bakery, if you bring your family to a bakery, you need to have masks on your family. You need to have gloves on your family because maybe the individual might not be worried about it, but the people around you should be worried because they don't know if you're a carrier. So I think it's really important that we get stringent on that. I think that also, I think the governor, there's some decisions this week that the governor will probably be talking about. We're still in the midst of having a conversation around schools and what's going to come next there. And then, stay at home, do we expand it or not? We're looking at our own curfew in the city of Boston. Do we expand a late night curfew beyond the 4th of May, which is probably, yes, we're going to do that. So I think that really it's incumbent upon all of us to be more disciplined. I think as I was yesterday, Saturday, as I went to the scene of the shooting of the little young woman, the young girl, I would say about 40% of the people had masks on and gloves and masks on, at least walking. Not everyone had it. It's not that hard to take a T-shirt or something and wrap it around, or a scarf around you as you go out. I know it's uncomfortable and it's awkward and you might not think it looks good, but it doesn't matter at this point. It's about keeping yourself safe and it's about keeping your family safe. Any other questions?
Mayor, how likely are students to go back to school on May 4th? We're about 2 weeks away. What do you think about that?
Oh, I don't think there's any question. Kids aren't going back to school May 4th. Now I think it's just, I think I've been talking along with other mayors and superintendents to the state about what do we do here. Do we open it up a little later in June and try and get a couple weeks in or not? And I would probably at this point, I don't think it's not too confident we'll have school this year. And I also think next year when school comes back in September, it could be a very different looking situation in the classrooms and something that we're going to have to be very cognizant of. And again, the work that we do today and the work we can do to prevent the coronavirus today can help prevent a surge happening in a few months from now. And that's a fear that I think we all have, that if we're right back where we are today, 3, 4, 5 months from now, are we better prepared for it? So I still think there's a lot of work that we have to do, not just now during this surge, but in the potential second phase of this, which could come.
Mayor, what would you need to see to reopen the city of Boston? Is it more testing? Can you tell me?
I mean, I think people are confused on what reopening means. I mean, I think that having Boston open the way it was on March 1st, where everyone was working and everyone was going to work, it's going to look very different when we go back to people going back to work and back to society. I don't think we're going to see the days of January, February, March for quite a bit. I think that it's going to be, because the threat of COVID is still going to be here. The virus is still going to be very much amongst our population here in not just Boston, but in the country. And I think that, as we think about it, we have to start thinking about what's the new norm. For example, here in City Hall, how do we open it up? What departments come back? Who can do work from home? How do we social distance? How do we protect our workers that are over 65? I think all of those questions are really about opening up. When the White House talks about opening up the economy, they're talking in broad discussion. It's going to be very different when we open up the economy and when we get people back to work. Restaurants, we don't know if they're going to be, all of a sudden now you can open and go out to dinner, or is it going to be social distancing? So all of those things need to be worked on and thought about right now as we think about what it means going back to society and opening up business. We certainly have to open up our economy at some point. I mean, it's moving along. It hasn't stopped, but a lot of our businesses haven't been as successful, haven't been as moving on all cylinders as they would like to be. Certainly, it's impacting our unemployment. It's impacting our tax receipts and revenue. It's impacting property tax. It's impacting restaurants. Impacting everything. So we do have to get back at some point to some type of normalcy. Yeah, the question is, we rolled out some meals for adults today, and what prompted that decision? We've been doing it all along, and many different places have been doing it. We heard of different areas that there's been problems with food access, so we opened up in those areas. But through the food bank and food pantries and soup kitchens and all the different organizations we have, they've been consistently giving meals out to families and individuals, not just students. So it's just kind of an expansion of that program.
Thank you.
All right, everybody, thank you.